A new federal report shows that early prenatal care is on the decline across the country. Data from the CDC shows the number of mothers starting care in their first trimester dropped from 78% in 2021 to just over 75% last year. The report's lead author says the overall findings represent a shift between 2016 and 2021. The timing of when U.S. women started prenatal care had been improving. Doctors warn this delay misses a critical window to protect both the mother and the baby. Visits give doctors a chance to share health guidance, and they can include blood pressure checks, screenings, blood tests, physical exams, and ultrasound scans.
There are things that can go wrong, and the sooner that we can seek medical care and receive adequate care and the resources for that, the better we are with longevity of that pregnancy and hopefully getting you closer to term. And if you're going to deliver preterm, we can get that baby prepared, to come into this world preterm and get the necessary teams and equipment.
The report also shows the decrease in early prenatal care was higher for moms in minority groups. Getting late or no prenatal care raises the risk of maternal mortality, which is much higher among Black mothers.